and welcome to the Dr. Bob Show. I think it's fair to say that if anybody has a pain that doesn't go away, whether it's a pain swallowing or a pain in the shoulder or a pain anywhere that won't go away, we begin to think about, could I have cancer? And if that is in your thoughts, you go to your primary care doctor and the doctor will examine you, get appropriate tests, and will make a decision of what was the cause of that pain. He may come back into the room after doing some laboratory testing and say, we've got something significant and serious to discuss. It looks like there may be something abnormal and it may be cancer, so we're going to have to do further studies. When that word cancer is used, immediately there's fear and prediction of what the future is going to be like. It's a natural thing to happen. But know that we're doing so much better on the treatment of cancer that you can have a feeling of, they're going to get rid of mine. Then the doctor begins to give different choices. They're essentially surgery, chemotherapy, or radiation therapy. We're going to be talking about new advances in radiation therapy, proton treatment for cancer, for solid cancers. And we'll learn what those are and what proton therapy can do. My guest is Dr. Ryan Grover. Dr. Grover is a board-certified radiation oncologist, cancer doctor, who spends his life teaching and curing cancers. I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about, are there ways that we can prevent cancer? And how is staying healthy and happy help you not get cancer? A lot of information for both of us. We're talking with Dr. Ryan Grover, board-certified radiation oncologist, and we're going to be talking about special types of treatment. Ryan, welcome to the Dr. Bob Show.
Thanks for having me, Bob.
How did you get interested in radiation oncology or oncology?
It was just chance. It was good luck. I was a cross-country and track athlete in college, and another athlete was back helping out at the meets. I was in medical school. He was a former athlete at the college that we were at. We were both helping out. I found out he was a physician, found out what he did. It was radiation oncology. It just so happened to be proton radiation oncology. And now fast forward 30 years ahead, and here I am. Wow,
that's a long time for proton therapy to be available. Where were you at that time? I know, but you tell me.
Let me do some math. The numbers sound bigger than they should, but that would have been around 2000 or 1999.
Where?
That was Claremont Mudd Scripps in Claremont, California, and that was at USC Medical School in Los Angeles at the time.
Now, is that hooked on with the word Loma Linda? Because that's where I was thinking.
Loma Linda is where I eventually ended up after medical school for residency, and that's where I did my radiation oncology training.
And that was where they had one of the first main proton therapy availability, is that right?
Absolutely. Yeah, it was the first hospital-based proton center. There were other proton centers that were affiliated with a research institute or a research cyclotron. This was built for patients first and foremost, and it was one of 3 treating centers at the time.
So proton therapy, proton treatment for cancer, what are some of the cancers that it can treat?
Well, the list is so long we would need a second show, I think, to talk about it.
So there's lots and lots.
Yeah, there's a lot.
Neck cancers?
Absolutely.
Chest cancers? Liver cancers?
Yes.
Really almost everywhere.
Almost everywhere. It's constantly changing, and the technologies are evolving. The way to integrate or the way to use proton and other forms of radiation therapy with surgery and with chemotherapy is constantly changing as we find better ways to do it. So the best way to actually figure out if your cancer is something that can be treated with radiation or anything in particular is to find a doctor who's familiar with the topic, get a consultation with them, and then talk about the next steps.
So what is a proton? We're going to go back into high school physics. What's a proton?
Proton is basically a single positively charged particle. So if you take a hydrogen atom, take the electron off, just take the proton, you've got it. The protons that we use, though, are not just the protons that you would find just kind of floating around or in hydrogen atoms. They're accelerated very, very quickly, or accelerated to very, very high speeds.
So you have to put them in a machine?
Yes.
The hydrogen atom?
Yeah, the proton itself gets injected. There's different ways to accomplish this task, but you take the proton and get it into a machine that's called a cyclotron. It's like a giant hockey puck, weighs hundreds of tons, and it accelerates the proton around and around.
About how fast?
All the way up to 2/3 the speed of light.
2/3 the speed. So it's really a go-getter.
It's going really fast.
And
yeah.
so does it throw the protons out and you harvest them, you capture them someplace? How do you keep them?
That's one way of putting it. The way I like to think about it is that when they get to their goal speed, so it's like when you graduate high school, you get your diploma, they actually get ejected from the cyclotron. And they go down this tube that's about 4 inches in diameter. It's a vacuum, so it doesn't interfere with the travel of the proton beam, and it gets directed by these sophisticated magnets that bend it and direct it into the room where the patient is.
And so that's what we're going to be treating with, those hyperactivated proton particles.
Yes.
How do you select and how do you treat if somebody has a cancer in the neck? What do you do to prepare the patient? How are they prepared?
Cancers in the neck can be particularly challenging to treat because there's so much important stuff in that neighborhood.
Yeah.
It's the swallowing, the speaking, just the way people look and feel about themselves, and because you can see your face, that's what you project to the world. So there's a lot that goes into the diagnosis, the correct management, and then guiding the patient through the different phases of therapy. There often can be surgery involved, chemotherapy involved, and different forms of radiation therapy, sometimes one or the other or in combination.
So you can use them in combination.
Absolutely.
Now, if we're going to use proton therapy on a cancer that's right under the skin in the neck, and we want, does it leave any burn scars, or does it, what's it look like after treatment's over?
It really depends on what kind of tumor you're treating, as well as where the tumor is. So there are some tumors that just don't need as much radiation to get the job done, and there are some that are really darn stubborn. The more radiation you have to give a tumor, the more you're going to start to get some irritation around that. So the skin can get irritated like a sunburn. If it's a deeper tumor, sometimes the skin will just get a little pink.
How do you decide how much proton activity to give a patient?
That takes several years of training to figure that out, but for the particular patient, what we use is something called a computer treatment planning software. So let me unpack that a little bit.
Good.
You have a computer treatment planning system, which is a planning software program that takes in the X-ray information, the CT information, MRI, PET scan, all of that information we put into one central place. We can use that to determine where the tumor is, and we can also use it to determine how to get the protons to the tumor.
So you're going to have to angle the protons or bring them in from a certain direction.
Yes.
And you're going to have to place the patient in a certain position also?
Correct.
So what are some of the things? I'm a wiggle worm, and I'm hard to keep still. What do you have to help the patient stay still? We've got some props here.
Yeah, one of the most important things about the things to keep in mind to help a patient stay still is really just to keep them comfortable. So that can be difficult when you have to lie in one place for the wiggle worms like us for sometimes 15, 20 minutes. If you're treating the neck like you explained or like you brought up, we have something called a special cushion, a mold care cushion in this case. It's basically a beanbag. It's soft, pliable, but if you spray it with water, these beads absorb that water and become firm and hold their shape. So this is like a very nice custom cushion for the back of your neck that will help make sure that you're in a good position.
Have you ever thought about using that at home if you got a stiff neck?
I have now.
So part of our treatment plan is to be sure that the patient is comfortable and stays in a position where we can guide the protons to come in and do their work. Now, how do you get the proton to the patient's tumor?
So that goes back to, if you take all of the things we've mentioned before and put them all together. So it starts with putting that hydrogen atom in the cyclotron, accelerating it to 2/3 the speed of light, kicking it out towards the patient room, through those magnets that bend it into the patient room, and then ultimately out a final magnet that directs it precisely to a location in the person's tumor.
So if it's coming precisely to a place in the person's tumor, when the proton gets there, does it, ouch, that hurts? Or you don't?
No.
So the person doesn't know it?
No.
So how long do you treat with the protons?
It takes about 1 minute to 2 minutes on average.
And that's what we're going to be talking about when we come back. What is the proton doing for 1 minute or so? And how do you know when to stop? And what are the advantages of using proton with something else? And there are some big advantages. You'll want to stay tuned. We're talking with Dr. Ryan Grover, board-certified radiation oncologist, and we've been talking about proton treatment and the advantages of proton treatment. So let's go back to the advantages and why we have elected to use protons rather than some other form of high energy radiation energy. So if we've got a tumor that's, let's say in the breast, that's in front of the heart because of where the breast lies, what are the advantages of treating an area in the breast with proton treatment and staying away from the heart? What are advantages?
Well, the biggest advantage with protons stems from the ability of protons to stop. When you accelerate those protons to 2/3 the speed of light, like we talked about, they come in through all the tissue, really not causing much damage at all on their way in, but when they hit the spot that we're targeting, they just stop and unload their energy. So we can use that to our advantage and deliver radiation to the breast tumor or the breast tissue without it passing through to the heart.
So that solves, to me, what would be a huge problem. So you stay away from other important structures. Does that same thing go with the rest of the body? If we've got a tumor in the abdomen that we can treat, you stop it right there where you want. You've got a Bragg chart here. Show me the Bragg chart. Oh
yeah, there is a famous property associated with protons called the Bragg peak. And sometimes that's a little difficult to explain, but a chart can help out. The Bragg peak was characterized, the Bragg peak is a characterization or physical property of protons. And there's a very well-known scientist, Robert Wilson, who thought, hey, I can use this property to treat cancer or treat tumors in the body. The reason he came up with that idea, or the property that he was referring to, was protons' ability to go into tissue at a low energy, and then once it reaches its destination, it dumps its energy in this peak, and then it does not continue on. To me, that's amazing, because that's exactly what you want. So here you've got the low energy that's not really bothering the tissue that it's going through. And you tell the protons where to stop, and that's right at the tumor that we're trying to get rid of. And it doesn't keep on going. It doesn't keep going. It's a low amount of dose that it's dropping off along the way. And then when it gets to its destination, it dumps its dose, and there's basically nothing left after that. So there's no exit dose. So when you're treating somebody, we can put that down the side there. Sure. When we're treating somebody and we've given them their proton treatment, how long do they have to stay in the hospital? Usually they're not in the hospital. Most patients, the vast majority of patients, they pull into the parking lot, walk into the clinic, get their treatment, and then walk out. Wow. So are they left with any other side effects? Fatigue, usually with radiation, you've got some fatigue a little bit. Fatigue is pretty common, but it usually doesn't affect your ability to get on with your life. I've had patients that I was treating who would ride their bike 40 miles on the weekend up and down hills. Some would even ride their bike to treatment and back. It can be significant, but almost all the time it's something like if you went to the beach, came home kind of tired at the end of the day, that's what people describe it as.
When you treat an area in the body with proton therapy, how frequent is the treatment? Do you just do it one time and that's it? Or do they come once a week or once a day? How often do you come for treatment? How long?
All of the above. So once a day or one time and then you're done is an option for some patients, and sometimes that's the best way to get the tumor treated. Other treatments take 7 or 8 weeks. It's generally once a day, Monday through Friday. The treatment takes about 2 minutes for each beam. It may take about 30 minutes altogether between setting the patient up, which takes a lot of work, requires a lot of precision before we turn the beam on. And then sometimes you're seeing the physician as well after the treatment just to make sure everything's going okay. And then usually you're on your way home in less than an hour.
So that's pretty ideal. You know, come in, get treated, know that it's taking away, that it's treating your cancer, and then you can go home and do what you want to do. Anything you can't do when you go home?
It really depends on what's being treated and the situation. There are some circumstances where patients have had surgery, or they may have certain chemotherapy medicines, or we may be treating a part of the body that they have to be extra cautious with regards to. But that's something that the patient and the physician need to be on the same page about, and that's part of the doctor's job, is explaining to the patient what they need to be concerned about and what they really don't need to worry about.
What is the most sensitive thing that you've got to describe to the patient about getting their proton therapy? Staying still? You're guiding them how to stay still. But don't be a wiggle worm. Anything else that you can tell the patient to help you with the treatment?
It really depends on the patient, and part of the initial consultation when I meet a patient for the first time and determine what the best type of radiation, chemotherapy, surgery path that they need to take. Part of that is assessing what is going on in their life, what kind of treatments they've had before, and then really trying to help them get through their treatment by identifying those potential barriers and then helping them get past them.
To me, it's almost an ideal type of treatment because you've got a cancer that's growing and you're stopping that growth in a period of minutes and allow the patient to perform normal activity. Anything I'm missing on that? Is it that easy for the patient?
It really depends on the situation. There are some situations, like I mentioned, that patients will come in, get their treatment, go home, certainly they can have some changes and some side effects, but by and large, they can keep golfing, they can keep riding their bike, all those things. There are other treatments that are just more intense, and they're gonna knock the wind out of your sails when you put everything all together. And it really just depends on what part of the body we're treating and what's going on with the tumor.
Do you ever do proton therapy before surgery, or it's usually after surgery? We were talking about breast surgery, and frequently it's done after the breast surgery. Yeah. What kind of surgery can you use proton first and then do surgery after? So you sort of hit the cancer with protons, and then you take out that area, and then you can add chemotherapy if you want.
Well, there are some tumors in the GI tract, so between the esophagus in and on the way out, there are some tumors in that path that if you treat them first with radiation and chemo, shrink them down, and then the surgeon may have an easier time afterwards completely removing the tumor.
So every patient is different.
Absolutely.
Every patient has to be treated differently. But proton therapy to me seems like it's a huge advantage on the total picture. Are there reasons why not to use proton therapy?
Oh, there are a lot of advantages, mainly that the radiation will come in and stop and not exit, and depending on what you're treating, that advantage will present itself in different ways. The biggest disadvantage I see is just the availability in general. There are specific disadvantages in specific cases, those are pretty technical discussions, but the biggest disadvantage is just that while there are now 40 centers across the country and counting, it's still a limited resource. We're the only proton center in East Tennessee, so if you're not fortunate enough to live in Knoxville, if you're further away, you're going to have a little bit longer trip to make it out here.
And the name of the Proton Center is what?
The Thompson Proton Center.
So Thompson Proton Center, Knoxville, Tennessee. I put a plug because I'm a big Knoxville fan. When a person has one tumor that's treated with proton, and they find another tumor within 3 or 4 months somewhere else, non-related, can you use proton again?
You usually can. When you're doing radiation a second time, it's always more challenging because you have to take the first radiation dose into account. Depending on where the tumor is, how large it is, and what it's next to, that's going to affect whether or not you can do another course of radiation.
That's what we're going to talk about when we come back. What if you need a second course? Is it better just to use surgery, or better to use chemotherapy, or better to use all three, or proton therapy to the rescue again? A lot of information. We're talking with Dr. Ryan Grover, board-certified radiation oncologist treating cancer, and we've got a Spider-Man mask. Why do we have a Spider-Man mask? We're going to learn about that. Ryan, why do we use a Spider-Man mask in treatment?
Well, usually our mask is not a Spider-Man mask, but a regular mask. It starts out its life as this flat sheet of plastic-like material that when we heat it up, it gets really soft and warm, and we can stretch it around the patient. It holds its shape and then allows the patient to maintain the same position every day. For the kids, we often will paint it like a Spider-Man or Hello Kitty or whatever cartoon.
I think that's so great because I think it gives somebody a personalized, relaxed, hey, this is not going to hurt me, this is going to be something that I can have fun with. And do they get to take these home?
Yep.
Oh, good. Yeah. So then they can really show people how this was part of my treatment.
Yep.
We were talking about two things that I want to be sure we mention. Number one is head and neck tumors. And number two, retreating a tumor that seems to come back. So take either one you want and go with it.
Well, sometimes you get both. There's been a rise as maybe in the community have maybe seen in cancers in the throat, in the tonsil, in that area. And one of the ways we treat those cancers is with radiation therapy, and protons can do a very good job of that. Unfortunately, no matter what kind of treatment patients get, sometimes the tumors come back.
Sure.
It's always more difficult to treat a tumor a second time, and sometimes you can't do a good job with x-rays, and those physicians will send their patients to get protons because we can do a better job often.
And you can do a better job often because you're more defined, you've got better equipment to concentrate the treatment where you want it to be.
It all goes back to that Bragg peak, Bob. The radiation comes in, hits the tumor, but you don't have to worry about that exit dose hitting tumor or tissue, normal tissue that's already received radiation.
I think that's absolutely fantastic and fabulous because you don't have to mess around with the tissue on the exit part where radiation's coming in. It's got to get out somehow, but it doesn't bother the tissue there. Great, great discussions. You're a great teacher, and I've learned so much on learning about radiation proton therapy. I want to thank you for coming to the Dr. Bob Show.
Thanks, Bob. My pleasure.
Great information. Remember those 4 things that we like to talk about at every show. Number 1, and they're so important for your general health, is number 1, exercise. You should be exercising 5 or 6 times a week. Make it 30 minutes. Get your tennis shoes out. You don't have to start running a real fast race. Just get out and get your tennis shoes to working where you can exercise. A little bit, no pain, no gain. So be sure that you exercise adequately and don't lollygog around and look at all the flowers as you're walking. 7.5 hours sleep. Studies have shown if we get 7.5 hours of good sleep, that we'll perform better, that we get less infections, that our personality, we don't get angry. People around us are happier. We're happier people when we have that 7.5 hours sleep. So if you're having difficulty sleeping, Try and figure it out. Is it medicine? Is it pain somewhere? And if you can't figure it out, you have to talk to your doctor about it, because he'll be able to guide you toward painless sleep, which will allow you to sleep better and perform better the next day. What we eat is sometimes who we are. So we need to pay attention to what we eat. We need to eat more fruits and fibers. So when you start breakfast, oatmeal's always good. Fruits are always good. Yogurt's always good. Small amounts are always good. And as the day goes on, then we can look at the foods that we go to a restaurant, and we know what's good food, and we know what's bad food. We know what's fried, fatty foods, and we know which foods are baked and are vegetables and have different colors. Do the same thing for supper. Enjoy eating. Eat what you want, but eat less, exercise more, and get a good night's sleep. And most of all, what is it we like on the Dr. Bob Show? Is that laughter in your life. You'll be amazed at how much laughter does to help the physiology of the body stay healthy. You'll stay happy, the people around you will be happier, and you'll live a longer, better life.